Hello and welcome everyone to Advocacy Grand Rounds with Doctors for America. First of all, I just want to mention that we are recording this session and it is being broadcast live on Facebook Live. My name is Farheen Qurashi. I am an acute care surgeon in Baltimore, Maryland. I am also a board member of Doctors for America. Before we start, I just want to take a quick minute to invite you to officially join Doctors for America. Being a DFA member today means taking the important and simple step of selecting a membership level and paying your annual membership dues. There are 6 different levels to choose from, and a DFA team member will put a link in the chat for you to join. Now getting to Advocacy Grand Rounds. The purpose of this Advocacy Grand Rounds series is to provide the over 20,000 physicians, medical trainees, and other healthcare professionals in our network with monthly training and courses to support advocacy efforts. This is modeled after clinical Grand Rounds that many of us are familiar with, but with a health advocacy spin. Again, we will be live streaming to Facebook Live and making a recording. So all these materials will be available afterwards. Just a few ground rules before we get started. Number 1, there is no such thing as a stupid question. Number 2, please use the Q&A feature during this session, and we will be able to address your questions and discuss during the second half of the session. And lastly, please be mindful and respectful of everyone here. We're all in a different place in our advocacy path. For some of us, this is the first step. For some of us, this is continuing education. We welcome each and every one of you wherever you are in your advocacy journey, and we encourage patience and good intentions from everyone here. Now, on to why we're here today. Let's combat misinformation. Our moderator today is going to be Dr. Alice Chen, an internal medicine physician and national leader in physician advocacy and public health. She serves as senior advisor to Made to Save, a national grassroots public education and outreach campaign on getting the COVID-19 vaccines to the hardest hit communities. She previously served as executive director for DFA, where under her leadership, the organization played an important role in the passage of the Affordable Care Act and Medicaid expansion. She lives with her husband and their 2 young children in Washington, D.C. Thank you, Alice, for being here.
Thank you so much. It is so wonderful to be back here with DFA, my DFA family. I spent so many of my years here with folks and I've been so excited in the years since I left to see new people rising to leadership and coming into their own voices in advocacy, because that's so much of what the heart of Doctors for America is. I'm really excited for our conversation today because we've all been swimming in misinformation and disinformation. And, one of Doctors America's key messages that doctors and medical students have so much power in your communities and families, in the country, to really sort of change the face of the conversations that we're having. But I know also that so many of you are feeling so frustrated and probably sometimes kind of helpless when you're met with whether it's patients or families or friends who are sort of spouting information that is going to hurt them or may lead to policy decisions that are just not right. And our conversation here is to really help arm you with a broader understanding of how you can combat misinformation, the role that you can play, and what are kind of the best tricks to use. The conversation is mostly focused around COVID-19, but this is applicable to everything that we do in public policy advocacy, everything. And so hopefully this will be helpful not only in this pandemic, but far beyond. So without further ado, I forgot we need to talk about the learning objectives. At the conclusion of this presentation, we want you to be able to, 1, identify COVID-19 misinformation, 2, explain the inaccuracies of COVID-19 vaccine misinformation, and 3, communicate effectively with patients and others about the COVID-19 vaccine. So I'm super excited about our guest today. We are joined here by Dr. Anne Schuchat, who was the Principal Deputy Director of the Centers for Disease Control and Prevention from 2015 to 2021, and served twice as the acting director. As the director of the CDC's National Center for Immunization and Respiratory Diseases from 2016 to 2015, she played key roles in the 2009 H1N1 influenza pandemic, the 2019 outbreak of vaping-associated lung injuries, and of course, the COVID-19 pandemic. She was elected to the National Academy of Medicine in 2008 and just is an incredible public servant, and one of those like amazing people who like from the seat of government is able to communicate so clearly with the public, and I've always so appreciated hearing from Dr. Schuchat. Also with us is Jory Craig, an expert in communication strategy, policy, and public opinion relating to disinformation and online harms. She's the head of digital communication and integrity at the Institute for Strategic Dialogue and has nearly a decade of international experience helping elected officials, political leaders, media, academic institutions, donors, and civic society organizations measure the impact of digital communication and influence campaigns on public opinion and communicate effectively in the wake of disinformation online. And I have learned so much about the ins and outs of disinformation from Jory, so I'm very excited to hear from you both. And with that, I will turn it over to Dr. Schuchat first to share some thoughts.
Thanks so much, Alice, and thanks to Doctors for America for the chance for me to be part of today's session. It's a real pleasure to join you all, and I hope we'll have a chance for a good conversation. I wanted to start with my frame of humility. I spent 10 years as the director of the National Center for Immunization and Respiratory Diseases and was at CDC for more than 30 years, but never have things been as complex, challenging, exhausting, frustrating as now. And so you as doctors trying to advocate and educate and care for patients, have my respect and appreciation. Much of the era when I was learning about communication and misinformation was surrounded with rumors and concerns about autism and mitochondrial disease and all these kinds of complexities with childhood immunization. But the COVID vaccination is a very different context. And so while some of the things are applicable, some of the challenges are greater. The second reason for humility that I have is that this is an emerging infection. And whenever you have an emerging infection, you don't have a track record. When you have a virus that can mutate and variants that are practically like new viruses, the collective knowledge needs to be couched in uncertainty or in basically avoiding absolutes, avoiding overconfidence, because that will come back to bite you with a large set of teeth. In communication, we can think about low concern settings and high concern settings. And low concern settings are things that are quite remote. For instance, there's a tsunami on the other side of the world and you're living in your community and it's important, but it's not a threat to you. In a low concern setting, a listener or viewer will attach credibility to somebody's expertise. So a meteorologist or or a expert in the country at large will think about, you'll assign credibility to somebody who knows about the topic or the locale. But in a high concern setting, like a public health crisis or any illness in your child, in a high concern setting, the way a listener or viewer or patient will assign credibility is based on empathy. The impression that you make of concern, of caring about the person in front of you or the anonymous viewers in front of you really helps a listener get past the who is that person and what are they telling me to the okay, I want to listen here. It's counterintuitive that empathy is more important than expertise. And as doctors or scientists or advocates, I think a lot of us have that feeling that I need to know all the answers. But if you can start with caring about the person in front of you or the people in front of you or the affected population, you will gain a lot of points. And at CDC, we often talk about people don't care what you know until they know that you care. And so if you're anxious about going to talk to that policymaker or do that media interview or face that patient or that, grand rounds, just remind yourself about empathy, and you'll relax, and the people that you're with will give you some extra points there. The other thing I wanted to talk about was sort of that idea of being an advocate or being a scientist in this era of misinformation and disinformation. And I want to encourage you to start with your doctor hat, not with your advocate or scientist hat, because I think that we as a public really appreciate the doctors that are in front of us, that are working day and night and taking care of us or of our parents or of our kids. And you will gain more credibility by being that caring profession than by all the letters and degrees and awards after your name. So it's a tricky time. It used to be that being in the government wasn't the bad guy, but being in the government now, it used to be that being in public health wasn't the bad guy, but public health is a target right now. But doctors are still pretty much respected. And so when you're trying to do your advocacy or education or outreach, I would use your doctor hat, which is, I think, what Doctors for America is all about. Another one of the mantras that we have at CDC when we do media training for staff, or when I got media training, was, CDC wants to be first, but we want to be right and we want to be credible. And you can optimize being first and you'll be wrong a lot. You can optimize being right and it'll be way too late. If you want to optimize being credible, you got to get out there early and you need to be right. And so trying to do all those three at the same time is both impossible and aided substantially by relying on the techniques of risk communication. And so if some of you haven't had risk communication training or looked at the manuals, I wanted to do a quick, what is risk communication and how do you apply it in the clinical setting or the advocacy setting or the media setting. The tips are really useful. When I got risk communication training, I was told, this isn't going to just help you in your job. It's going to help you in your marriage. It's going to help you with your parents. It's a really useful skill set. And then you'll notice everybody doing risk communication on each other and you get a little suspicious. But basically, the principles are really built around that high concern setting where emotion is high, fear is high, all of our autonomic reflexes are going, and we want to put people at ease right up front. And so empathy is very, very important. A second thing that's really important is honesty. It's hard to be honest when you don't have all the information, or when sometimes you have information and you're not allowed to share it. Happens all the time in public health. The doctor hasn't told the family yet. The health department knows, but they can't tell CDC, or they tell CDC, but CDC can't tell anybody, on and on and on. So you need to both be honest and portray honesty. That can come with transparency. The more you can be open about what you know, what you don't know, what you're doing to find out, the more you'll build on that honesty and trust that you're really trying to achieve. Another tip is to avoid absolutes. I cannot tell you how many people, all of us practically, but how many high visibility people have gotten trapped in an absolute. That will never happen. Sometimes that's not what they said, but that's the clip that got pulled out. It's really, really unlikely is a whole lot better than that will never happen, because absolutes prompt a reaction of disbelief. Really never, it's just never going to happen. I don't know about that. It's 100%. That's really hard to believe. The other thing that's helpful to include in the risk communication is giving people actions that they can take so that they're not helpless in the face of this crisis. And that's sometimes tricky because you don't want people to waste a lot of energy on something that's not useful. You may not know enough about what's really going to help, but in almost every crisis, there are things people can do. They can make a plan. They can talk to their family. They can get ready for what may come. So giving people actions helps them regain some control and participate. And when you're a participant in a response, it's just immediately calming. I have to say I'm a very nervous and anxious person naturally, but being in public health, I loved being, in the middle of crisis. I always had a job, I didn't have to panic because I had something I was doing. And so people really don't panic, but they want to know, they want to have trust in the people talking to them. And they also want to be able to help. The other thing that's very important for media or advocacy is to foreshadow changes. The idea that here's what I'm telling you today, based on everything that I know and everything that we're learning and what we know from other viruses or other epidemics, but it could change. Or today, it looks like we've contained the virus, but that is not likely to last for very long, and it could get much worse. So helping people know that things could change or even are likely to change. The Delta virus is this, but it could change. We could get another variant after Omicron, and it could be worse. Or those vaccines that were so protective might not be as protective against transmission anymore. We try to frame recommendations and guidance in the midst of emerging infections or pandemics as interim. This pandemic is really testing the case though, because there's only so much patience people have. You can only change things so many times and not lead to backlash or anger. And I think we're kind of at that stage right now. But if you begin up front with it could change, we're going to tell you what we know when we know it. We're going to update information and guidance when we have better information. And it doesn't mean we're wrong right now. If we change something, it means we're learning and that we're finding better ways to address things. So all of that said, there's a limit to how good risk communication can work when you have the politicization that we've had, and when you have the deliberate disinformation that is not at all about, confusion, which is really what misinformation is. It can be hard to explain these very complex ideas, but we have some pretty organized disinformation campaigns going on right now. We saw precursors with the measles in the Pacific Northwest, and real targeting in New York City area of Hasidic Jews, and there was some disinformation that was very targeted. But in this particular pandemic, it's just at a scale that we've never seen before. The examples for our misinformation, disinformation, confusion, complexity are ripe right now. Masks, vaccines, isolation, quarantine, ventilation, aerosolization, transmissibility, on and on and on. But what you can try to take away is that you can be compassionate, you can be empathetic, you can say what you know and how you know that, and what you would do for yourself or your family. The last thing I wanted to talk about, which I think is controversial and complex, and I'm not sure my thoughts are fully formed on this, is this whole question of blaming the victim. Somebody comes to you as a patient, or someone in Congress or the state legislator tells you, well, I think it's this. And, you feel that this view that they're promoting is just really wrong. If you can handle the patients to try to retain that empathy and start with the frame that this person may have been targeted. This person probably doesn't want to have bad things happen to them or their family. And this person probably has been led astray by some sort of either intentional or unintentional targeting. That will help you get your point across. If you can start with listening, what are your concerns? What did you hear? How, maybe let's talk about that, rather than assume that, they don't want to be vaccinated because, they're stupid. I mean, if you start with what is the question that you're worried about? Well, my child had a really high fever last time, or I read that, this can cause infertility, or, the most important thing to me is not missing work. And am I going to be so sick the next day that I miss work? If you just pause and listen before you launch into everything that pause and listen to understand, you know, you could be completely off with what you think their concerns are, and addressing their concerns appropriately requires listening. Very hard with the media because you don't know who you're listening to, but with politicians or patients or the general public, you can get a sense of what are those questions. I think we need very separate strategies than risk communication to deal with the disinformation. And I think Jory's going to talk a bit about the context, and I will give Jory the hopeless task of taking on this really difficult context we're in. But those are just a few thoughts on how to talk to patients, politicians, the media about things that are deeply important, and try to sustain or gain trust and credibility while you're doing so. Thanks.
I'll go right ahead and jump in at that not so easy task. But I also want to start by saying thank you for having me, and thank you to all of you. As someone, I think the only person here who is not a doctor, I can't tell you how grateful I am, my family is, and everyone in my life is for the work that you all do. And I feel honored to be here. I also feel funny being here because, of course, I all really just want to listen to you all in this moment. But my teams have been studying disinformation, how it moves on the internet, how it relates to misinformation. And we have been doing this for about a decade as the dynamics have evolved. And of course, 2020 was the most incredible year for disinformation dynamics, not only because there was a pandemic, but because that pandemic put us all in a more virtual reality than we had ever previously been, and removed much of the in-person contact that actually does create resilience for us when it comes to whether we are susceptible to mis and disinformation. So I'm going to jump in. I want to first echo so much of what Dr. Schuchat said. In fact, so much of what she said is often in the trainings that I do with any type of audience on how to just respond when a family member or a person you know comes to you with some type of mis or disinformation. Empathy is really such an important part of this. And not only is it important, but we're really working against a tough backdrop when it comes to leading with empathy. And I give the example, even this event is called Let's Get Vaccinated, which I love that. But the concept of fact is a hard and somewhat cold concept. You can imagine the media with their sort of high production intro to the news hour saying, we're going to give you the hard facts. And that's sort of the backdrop we're living in, where there are a lot of people coming to us, telling us in a very hard, serious way that facts they exist and you should know them, and we know them, you should know them. And this dynamic is all very hard. And what Dr. Schuchat, much more eloquently than I could, told us just now is we really do need a much warmer approach that acknowledges a lot of the uncertainty, both about this moment and about what we know about this medical situation. And so I would encourage you to sometimes even consider saying things like that out loud, especially the power that you all have as medical professionals. I think folks probably inherently think of you as folks who love facts, and you may be. I think we all want to love facts, but to have that acknowledgement come from you all, I think is very powerful. To have it come from any experts, to have experts say there's nuance around, facts and what we can know at any given time is really, really powerful. The second thing I want to talk about is that this dynamic in particular is challenging for a few different reasons. In 2020, because of social media algorithms and the way in which people were spending time online, existing communities that had some precedent to be susceptible or already believing in vaccine misinformation or medical misinformation were exposed to both more of that content than ever before, and to others who maybe were coming at it from a different angle than them. I'll give you an example. The wellness communities online who maybe question or are interested in alternative medicine to Western medicine, parenting communities that are traditionally just to share things about what to bring to their children's soccer games, or, what activities their kids are doing. Groups that are dedicated to specific vaccine hesitancy, which has been around for a long time. Add that on top of all of the political groups who started using words and talking about medical disinformation. The algorithms exposed those groups to each other. They made suggestions to people that they might be interested in groups like that. And slowly we saw those communities, which used to look very distinct, become more and more overlapping, both in the networks and in the content. And so really, you don't know why a person might be coming to you with their belief. You don't know what their starting point was. And there's a really high chance that it's not what the media might make you think, that they've gone down some rabbit hole. It might be the case that they didn't go down really any rabbit hole. They're in their normal groups full of other parents, or they're in normal groups that are, based in things that don't have to do with COVID disinformation, and being there because of the way the algorithms work, expose them to that misinformation in 2020 because of those supercharged dynamics. The second dynamic that makes this really challenging is that we all have really different starting points with our own online experiences. And so when we are talking about what we learn on the internet, more times than not, we're speaking different languages to one another. Depending when you started using social media, depending how old you are, depending whether you have children, you may have exposure to a totally different diet of social media platforms. So we know that Facebook and YouTube are still the most widely used. That's about in the high 70s. That's percent of Americans are on those platforms. And then that's followed by Instagram, and Twitter comes after that, which often you would feel like Twitter has much more people on it than it actually does, but it's actually only 24% of people. Increasingly younger children are getting off Instagram. They're moving to TikTok and Snapchat. You have certain diaspora populations that are really disproportionately using WhatsApp for their social media. And then there are others that I'm not mentioning. But the point is, it's hard to be speaking the same language when we're talking about what we see online, and that can make it more challenging to feel like the person you're talking to is relating to what you're saying. It can kind of go over folks' heads. The other thing that makes this challenging is that the media is very loud about what's happening online, and it can be a really great story that gets them a lot of clicks if they talk about some of the most surprising pieces of misinformation or disinformation on the internet. What our research tells us, though, is that the majority of people do not believe in very specific dis or misinformation narratives. Their beliefs fall somewhere much more closely to skepticism. So something like, I feel like there's not been enough research done. I feel like this has come out too fast. And all types of disinformation and misinformation, but explicitly the disinformation campaigns that are really targeted by bad actors who know what they're doing, who are there for profit. They are really focused on the trust dynamics. So the most effective disinformation erodes trust. And so if I tell you, how do you fix the erosion of trust? You're likely not to say, oh, well, there's a fact for that. You're more likely to say, we would have to build that trust back. And so understanding that, like Dr. Schuchat said, the folks who are coming to you with this, it's not that they have taken up an incorrect or crazy fact. It's that there's been a targeted campaign for them to feel less likely to trust the folks that have been deemed experts by the majority of society. And so that those trust dynamics are really built in to the tactics that they use. And I'll talk a little bit about, what can be helpful in acknowledging those tactics. And before I do that, I just wanted to, again, echo Dr. Schuchat. One thing I'm saying all the time in my trainings is it's really important to listen to understand and not to respond. So, it can be so, and I'm sure, I can only imagine the pressure to have answers. But given that there aren't clear answers right now, that understanding can really go a long way. The other tips that I have, and then I'd love to take any questions that folks have about what we see online or other really specific questions. Again, I don't know your starting points on the internet, so you all might have very specific questions for me and I'm happy to answer them. But just a few tips that sort of consistently work and have worked since the start of the pandemic. So I tell people all the time, if you don't lead with the acknowledgement, if you get to the acknowledgement third or fourth in your conversation, you likely have closed ears. So the acknowledgement piece of this, whether you're acknowledging the foreshadowing that Dr. Schuchat mentioned, and you're saying, you know, this is what we know now, but you know, we may learn more later, or it's been a challenging environment, that keeps ears open, which means you have a chance to get something else through to them. If you don't lead with it, you likely don't even have the chance to have what you want to say heard. In my world, people really spend a lot of money coming up with the perfect words to be persuasive and the exact verbs and adjectives. If they don't have open ears, it doesn't matter. And open ears will happen if people trust you, if they feel like you care about them, as Dr. Schuchat said again. And so that really needs to be the first step. The second tip is talk about your process and your experience with dealing with the current online social media information system we're in. I like to give the example of how this is really hard for all of us, including me. I am an expert in this. And in 2020, there was a video that was claiming that the dolphins were now swimming in Venice in the canal. You know, and I liked that video and I remember sharing it with somebody, and it later came out that that video was not real. It had been, you know, changed, and it's a, you know, less dangerous example, but it shows that this is not easy for anybody. There's nobody in the current information environment who does not, whether it's getting spam phone calls or spam email or spam mail, or, you know, no matter what, we're all trying to wade through different information environments right now. Nobody is immune to it. We're all susceptible to it. And especially with social media, if you can talk about your own experience, maybe you can say something like, you know, sometimes I spend too much time on social media, more than I'd like to, or, you know, social media has really been putting a lot of pressure on my kids. If you can just talk about the challenges that you also have with this environment, it can move it away from what you know, what they don't know. It can move it away from the power dynamic that must inherently exist between a medical professional and a patient, and put you more in a human peer ground that can just make for a better dialogue. You might even get them to open up then about some more of the challenges they're having with what they see online if you share some of that yourself. And then finally, I really recommend we language. I language and social media in general promotes sort of individualism, individual opinions, sort of your own take, your own hot take on a situation. That sort of, you know, really individual mentality is sort of at odds with what we're all going through, right? This is a very collective shared experience. So the more that you can say we, the more that you can, if you're going to talk about this on your own social media, tag colleagues, tag other people, bring other people into your experience, make it less about sort of a showmansy sort of preaching of knowledge and more about a, hey, we're all in this together, let's talk about it. So those are my main points, but very happy to take questions. And again, just really grateful for all of you.
I'm sitting over here just like furiously taking notes on everything you're both saying. This is so incredibly helpful. I know that one question on folks' minds, and folks, please go ahead and put questions into the Q&A box, and we'll answer them as we go. If you have your hand raised, we're not doing a live question, so just type your question in. I know that a lot of folks are like, where should I put my energy? Is it that one-on-one conversation with the patient? Is that hopeless because that's 1 out of a million people who are misled? Should I be going after the disinfo people? What should I be doing with myself? What would your advice be?
One comment that I would make is about reinforcing the social norms. And I think it kind of gets to where to put the energy. I think it's very easy on social media or on regular media to think that, the whole world doesn't want to get vaccinated. But, the statistics don't show that to be the case. Almost, the vast majority of adults have been vaccinated, and, children not yet, but most people are opting in. But the stories that run are not that. So even most of the people, the politicals that are saying, no, have gotten vaccinated. And so it was true with childhood vaccination that, people really overestimated that anti-vaccine population. And so in the one-on-one conversations or the meet or whatever, stressing that, most people are doing this. And so, after the listening, helping people realize that they're in the mainstream. It's a mainstream thing to accept. But I think in terms of where to put the energy, with the childhood vaccine issue, we really said, like, don't engage, don't deal with this extreme, because that is the fringe, and engaging with the fringe is giving the fringe attention. And so in the non-social media targeted disinformation world, not engaging with them makes sense, because most people are in this undecided or open or considering change. And so dealing with that group makes more sense, or, individuals or groups. But I think in the disinformation era, kind of understanding what are those motives? Is it profit? Is it disruption? Is it, I'd love Jory to tell us what's the story on that, like, why is this happening? But I think that, the really extreme, there's just no benefit to focusing on that. In the encounters anyway, not a point by point on TV or a town hall with, somebody very extreme. You're just giving them credibility. And that was always our advice. But Jory probably knows the modern answer is different, I guess.
No, you consistently are sort of speaking the talking points that I normally speak. So it's really reassuring to me that we're in sync. One of the biggest tips I give to folks is questioning the motive of the messenger. I think that, as doctors, you're in a unique position when it comes to that, because what you say just really has a high potential to confirm a belief that's being put out there about what and why medical professionals might be pushing something like this. There are an array of disinformation campaigns. I see someone asked a question about a disinformation campaign that is particularly affecting Florida. I would say the role that you have in a conversation with folks is not to, again, tell them what you know, but to help plant the seed of a question and sort of chip away at their strong hold on the beliefs that they have. So for example, you might say, whenever I'm looking at someone who's talking about vaccines or talking about COVID medical information, I ask myself, what's their motive for saying what they're saying? Now, that's the question. In that case, in the Florida case, the folks that are pushing that have a political agenda, and they are in fact politicians, and they are connected to the political moment. And so without having to call that out specifically, you can say sometimes people have a political motivation for trying to talk to folks about this and make them ask questions or be the one with the answer. Sometimes people want folks to buy their product. So I would recommend not sort of feeling like you can only engage in that if you have the answer, because honestly, even those of us who track disinformation, it takes a lot to get to the root of who's behind what. There are a lot of ways to disguise it. And one of the most popular disinformation tactics is to blend in. We know that people create fake accounts. We know that there are people who have maybe they are doctors, but there are people who are claiming they are doctors online who are promoting medical disinformation. So that, again, it comes back to this sort of trust and asking questions and making it clear to folks that, you know, this is a hard environment, and thinking about who might have their best interest, who might be doing what they're doing because they care about the person versus having some other agenda. That's what I would say. Sorry, there are dogs around me.
I mean, maybe just one more comment in terms of that motive. I mean, to me, as a public member now, you know, having retired from CDC, the most compelling messengers to me are those clinicians who are dealing with stressed systems. You know, the ICU, the staffing shortages, the appeal that is, you know, my motive is that we can't keep caring for those who are sick because so many of the beds are filled with unvaccinated people with severe disease. So I think that getting at that motive, you know, I don't have a horse in this, except that I'm caring for a lot of sick people and there's no more beds, and your loved one might not get in here if we don't get more people vaccinated. It is really difficult with the politics, but I would say trying to not have to get political to counter the politics. You know, since you do have the medical Doctor for America angle, that's probably a more compelling to the average folks. You know, I'm sure that there's other ways to get political, but in terms of the trying to be persuasive, it may not help to be political, to be persuasive about vaccines.
The other thing that I would say, I meant to say this before, on where I would dedicate energy. So something I remind folks again of all the time is where people are online. And I would suggest, if you have the opportunity to, in a consistent way, offer to answer questions or offer to provide an open space for bringing questions up. And if you can do that in a more mainstream platform like Facebook, where there are more people, Twitter is great for sharing with peers, reaching the media, reaching really high news consumption audiences, but it is not the best platform for communicating with the general public. And so if you can go to those other spaces, and, you know, they're not spaces that are typically this as good as Twitter is for sort of hot takes again, but if you can open and say, I'm here, I will answer questions, I'll create a community or a space for people to, you know, to bring their concerns to, that could be very powerful as well.
That's great. I remember my dad was like, why are all these like governors not fighting COVID? I was like, they don't want to be president. He was like, huh? Speaking to the motive piece, like, what? They don't all have the same motives in this pandemic. Well, one of the questions around is that it's also kind of related to this Florida example. Is I think a lot of folks in Doctors America are very frustrated about the doctors specifically who are out there spreading disinformation, and like wondering, can we just boot them? Can we like yank their licenses? What are the feelings on that?
Yeah, I mean, I think probably each of us has our personal view on that. One thing I would say is, you know, I think medical boards should take action where they have, you know, misdeeds. You know, I think we shouldn't hold them back from that. But I would say, going back to the vaccines and autism issue, that Wakefield's license was pulled because of the actions that he had taken in sort of promoting the idea that vaccines, you know, the question was a legitimate question, but the studies didn't pan out. And he continued to, you know, he had a lot of bad behavior, but he became sort of a martyr and hero by having like his license pulled and so forth. So I think you want to consider the appropriate, take the appropriate steps if a person's not, you know, practicing within their scope or doing, you know, or doing dangerous things, but realize there may be some unintended consequences of that. It does seem like it just isn't right that people can continue to, you know, be doing things that are dangerous and harmful for profit or for, you know, these terrible motives. But to make sure that, you know, that there's appropriate steps taken to take action, and not something that could create a cause celeb that you don't want.
Makes
The
sense.
only thing I will say, and I am not qualified to answer the majority of that question, but I will say for sure that the disinformation narratives that exist, especially those that look to erode trust, have already accounted for and anticipated things like that happening. So things like that happening can confirm and deepen the validity of the disinformation narrative. If there's a narrative around there being a secret group of individuals who gets to choose who has an opinion, for example, that could reinforce that. The other thing is, I would say, open up to folks about your process, about how you know which peers you listen to. So, I don't think the average person knows what certain accreditations necessarily mean. I think I can tell you for sure that some of the most widespread disinformation, especially a lot of the politicized disinformation, references trusted sources out of context. So, they will cite CDC data, and then they will make all these other claims and not give the full story. So talk about, again, your own process of making sense of that, or of how you know which of your peers you trust, to make it about a collective thing we're all trying to sort out, and less about a, you should know better moment.
I think just to expand on something that you mentioned, I think this, we are in such a data rich moment. There's a data point for everything, and whatever your opinion is, you can probably find a data point out there, and maybe it's on CDC's website for all I know. But I think that that's quite dangerous in terms of the lack of context, the soundbite versus the fully qualified information. And so I think that it does speak to that figuring out how you can be credible and gain trust, and then have the space to explain. Because we've all, I think that at least I have definitely been misquoted, or things have been taken out of context and used as an argument against whatever I was trying to actually say. So I would be careful about the facts. Mhm.
Speaking of facts, I'm going to kind of like zoom from like the big question, big conversation, to kind of like specifics. There, like a couple of sort of misconceptions, particularly about the vaccine, that I think a lot of folks are hearing about. One is the fetal cells are used in vaccine. This is a question from Mary, and one is sort of like people who are worried about fertility and impact on reproduction. So like, how do people respond, or how should people respond when they get those questions?
Right. Yeah. For the fertility question, there have now been good studies done of pregnancy and COVID, and risks and benefits. And it is clearly beneficial for pregnant women to be vaccinated against COVID in terms of their health and the outcome of the pregnancy. In terms of the questions of fertility, there was a study that suggested a little bit of delay, I think, in menses, but not something that had a significant effect on fertility. So rather than say that's ridiculous, say, of course, women want to know, is my fertility going to be okay? Not sure where that question came from, because I don't know of vaccines that affect fertility. Chemotherapy can, but maybe that was one of those disinformation things, but the data are really reassuring in that. And so again, if I were dealing with an individual, I would say, oh, you're hoping to have children. That's great. Of course, that's an important question for you. Here's what I know. There've been some studies, and it's really reassuring. I wonder if that question came up, where that came up from. Obviously, women want to know about fertility, but I'm not familiar with any data that would support that concern. Something like that would be what I'd say. In terms of the fetal cells, I haven't tracked, which things used what, but there's some good content on the CDC's website about both, what vaccines really are made of, and, even the Catholic Church's opinion about things. The Pope has, weighed in on the value of vaccines and the sources not being of concern. But there's some of these persistent, they're almost like, I would just dropped into the social media context periodically to get people riled up again, and are really not viable concerns. So, I think somebody should probably start the rumor that Viagra is made out of, fetal cells and see if there's a quick nixing of that concern. But it's drops into the dialogue every so often.
Indeed. Oh my gosh, we're almost toward the end of the hour, which is unbelievable. I feel like it went by so quickly. I'll sort of like wrap up sort of an additional question that's come in with sort of a broader question, which is, what someone was asking, so there's two reasons for vaccination: decreasing transmission and preventing illness and deaths. Now that we have Omicron and there's lots of breakthrough infections, is transmission prevention still like a legitimate rationale? So it's we mentioned this earlier, but like everything is changing constantly, which makes it feel like it's very hard to be like, I am credible because I know. And sort of like how in this situation do we sort of like build that trust and credibility? And like, I guess sort of like the underlying question is is like, is it hopeless? Because these disinfo people are so well organized and well funded, and we see people coming in every day saying, I want ivermectin or else. Can we actually win? Can we actually make headway?
I think that we're making headway every day, and that the vaccines effects, even in the face of evolving variants and really severe ones and really transmissible ones, there's an enormous amount of prevention happening. Just the idea that the ICUs and hospitalization and death is that vaccination is really protective in most populations at this point against those outcomes, particularly with boosters now. But it doesn't feel like we're winning, because this virus is still circulating, and there is lots of transmission going on, and the disinformation is only going to get worse in a midterm year, and in the political environment here in the U.S. And whatever happens with Ukraine and Russia, things could get even worse on the disruptive effect of some of the cyber disinformation. But I think that stepping back and saying, we have a totally new pathogen. It's caused a worldwide pandemic. We got a vaccine in record time and have distributed it to the vast majority of Americans, and have a long way to go internationally, but still we're really making progress there. 10 years ago, we never would have imagined we'd get several vaccines in this amount of time and have the capacity to deliver them. So I think we have a lot to build on, but people are really, really tired. And so this transition as we go forward into what does it mean day to day? We have tests, we have masks, we have vaccines, we have policies, but we have to adapt. And what will we be looking at a year from now or 6 months from now is a good question.
I have hope. And my job is I look at a lot of not great stuff online a lot, and not just about COVID, but hate speech and extremism. And I have hope. I do have hope because I also talk to a lot of people in doing public opinion research, and they are resilient, and they want to be on the right side of things. And everyone is really tired. I agree. And I do think, you can think of the person who sort of always raises their hand in class, and sort of, if you read a transcript of a class, they would take up a lot of oxygen. That's a lot of how the very few loud folks on social media are. If you read a transcript of who talks the most on social media, you'd be like, oh, yikes. There's so many folks who happen to be loud. That's not the majority. And as they dig their heels in, and as they are more stubborn, and as the people around them are healthy and having positive experiences with the vaccine, their loudness actually is in stark contrast then to the sort of carrying on and moving forward experience that they will have with their neighbors and with other people in their lives. So I do have hope, and it's definitely much in part to all of you here.
Thank you so much. Yes.
Just going to say, I think some of the comments have been about Florida, and I think for those of you living in the Florida environment and trying to address what seems insurmountable. You have my support. I wonder whether there's some communities of the older population there that doesn't have sort of the suspicion about vaccines and new things that has been so hard hit by the pandemic. That may be a source of strength. It may be the politics just has to be addressed politically, but the medical side of things, it's been such a hard pandemic for the elderly, and the vaccines have been so life-saving. The issue of being able to be with grandchildren and to have that connection regained because of vaccination is really compelling. So I don't know how much that helps with the politics side, but it may help with some of the voices that haven't gotten much attention yet.
I love that. Thank you so much for sharing your wisdom, your advice, and your hope. I think this is very much appreciated, and I'll pass it to Farheen to close us out.
All right. Well, again, thank you everyone for joining us today. I want to close this grand rounds by thanking Dr. Alice Chen, Dr. Ann Schuchat, and Jerry Craig for this great conversation. We're so grateful that everyone was able to join us today. If you want to continue and share this with friends, family, others, you can watch this event later on DFA's YouTube channel. Also, if you want to get more involved, DFA does have a vaccine expert core. The link is in the chat where you can join and have opportunities to talk to people in the general public or at events where people are interested in asking doctors these types of questions on the vaccine. So please take a look at that link if you want to get more involved. We always like to hear what people are interested in and what you want to see at the next Advocacy Grand Rounds. Also there's a link in the chat for a survey, really quick, 1 or 2 minutes. So we'd appreciate hearing from you because we want to make sure that this is something that you all enjoy and that is helpful. And lastly, thank you again for joining us and for everything that you do for DFA, for advocacy, and for your patients. Again, we hope that you'll consider becoming an official DFA member. Please take a look at DFA's website. Link is again in the chat to see what the benefits are of membership and the different membership levels. And lastly, we are on Twitter and LinkedIn and Facebook and all of those great social media things. So please follow DFA there for other great ways to get involved. Thanks again.
Thanks.